So, productivity in acute care. So, when I was looking at acute care, I found that 76% of hospitals have productivity requirements. So, there's still about a fourth of them that may not. And within those, the average productivity requirement was about 78%. And that's coming from an ASHA survey that they do. 78 is pretty close to the norm of 80% in productivity in general. So that's not super unrealistic. However, when you think about having 106 minutes for gathering materials, calling families, doing your discharge planning for acute care patients, going to care meetings, documentation, and consulting with the other professionals, which is really critical in that setting, as it is in most, 106 minutes can go quickly. So, some things that I found that you want to consider whenever you're trying to really meet that productivity requirement and use your time really efficiently are you have to consider, are you putting the right patients on the caseload? So, is this patient who just got admitted ready for evaluation? Is this patient one that I really need to be treating right now? So you have to ask yourself, what is your priority of patients? And then you have to think about evidence based practice for the frequency and intensity of services. So, for what time is it most effective to treat this patient? So that way you're not wasting minutes that may not actually be effective. And then for wait time, we're thinking about those minutes where things didn't go as planned, which is going to be pretty common in the setting. So you came to do an assessment and there's another physician in the room, or you came to work with your patient and they're out for another assessment. So with those minutes, you have to ask yourself, can my time be better used somewhere else? Should I be going on to another patient rather than sitting around and waiting? So that way your productivity doesn't sit there and drop as you're really not spending any time with anyone. And then I also just wanted to add that the collaboration with all of the different physicians, nurses, social work is something that is critical in acute care. So you have to allow time for that. And I think that's where finding a job that they don't completely drive productivity and allow for a little bit of flexibility so that your time can be best utilized and your therapy is more important than the rush to get things done, is important. And it's a question that I think to really ask when trying to get a job if possible.